I've told my pregnancy loss story to more than 50 medical professionals, not because I wanted to, because I had to. Every new doctor, every new appointment, every new pregnancy, I had to relive my trauma. And the medical system, it's not designed for that. Today, I'm talking to healthcare providers about what needs to change, but I'm also talking to lost parents because you need to know you're not alone in the exhausting, traumatic cycle. My name is Bianca Johnson. I'm an empowerment coach and the author of all of these lines. It's my story of my 8 pregnancies, 6 losses, 2 of which were terminations, 3 miscarriages in a year, a missed miscarriage, and 2 living children. For more than 12 years, I've supported lost parents through Rainbow Hope South Africa. Not a medical professional, but I am an expert in the patient experience. In this video, I'm going to go through how many times a person who's experienced a pregnancy loss has to retell their trauma. Why just moving on is impossible in this system. What trauma-informed care actually looks like. What healthcare providers can do differently. Let me take you through just one of my pregnancies. My son Kyle, my first successful pregnancy after 3 consecutive miscarriages, and my 4th pregnancy in a year. In that 1 year, I had told my history of 5 pregnancies to my GP, confirming the earlier pregnancies, a new OB-GYN had managed to secure an appointment with a new obstetrician for my 3rd miscarriage. That gynae's receptionist, needing to fill out the medical history form and explain my number of pregnancies versus number of children, which obviously didn't correlate. To the gynae's nurses and assistants, particularly his radiographer when she was doing my scans, a new therapist who I started working with during that time, a medical aid broker when we changed medical aid, an insurance clerk when we changed life policies, my first chiropractor, a herbalist and a nutritionist who both needed to know an entire history in order to appropriately assist me, pathology lab staff, at least 3 different people, multiple blood test appointments, hospital admission when I was checking in for my birth, and again, needing to fill out how many pregnancies I've had versus how many children I have, hospital labor ward nurses so that they had an idea of what was going on, and then the pediatrician who also asked whether this was my first pregnancy and first child once we'd actually given birth to Kyle. That's at least 20 people for 1 successful pregnancy, and that was in just 1 year. In the 11 years since then, I've told my story to a new GP because I moved areas, 3 more OB-GYNs for subsequent pregnancies, a maternal fetal medicine specialist for the high-risk pregnancy that ended my fertility journey, more radiographers because every pregnancy needs scans and the staff change, more pathology labs, every pregnancy equaled more blood tests, 4 more therapists over the year, more chiropractors, a reflexologist, various massage therapists because they also need to know your history, insurance agents, at least 6 every time we changed medical aid or our life insurance needed us to do another interview. I then had to go through and specifically give details of every single pregnancy, when it ended, how it ended, etc. Our financial planner and debt consolidator because our debt was tied to our fertility costs, a personal trainer because your pregnancy history affects your exercise regime, blood bank staff. Every time that I go to donate blood, for the best part of 9 years, I had to mark pregnant in the last 12 months. So that's at least 8 people over those years. And those are just the medical and adjacent professionals. That doesn't include family members who ask, why don't we have any more kids? Strangers at school pickup who assume I should have more. Friends who don't know my history. Every new person in my life who asks about my family. Every single one requires me to decide, do I tell? How much? Can I handle their responses today? The math's simple. I've told my story in full or in part to more than 50 medical professionals. Some I've told once, others, like my long-term gynae, I've told repeatedly as situations changed. Do you know what that does to a person? to have to relive your trauma 50 plus times, to watch professionals' faces as you recount dead babies, to see them glance at the clock because your trauma is making them run late. The medical system is not designed for this, and it's destroying lost parents. After my losses, I was told by doctors, by therapists, by well-meaning friends to move on, to focus on the future, to try again. How do you move on when the system requires you to constantly look back? With every new pregnancy, how many previous pregnancies, any complications, previous miscarriages? I have to count my dead babies. I have to list every loss. I have to relive each of those miscarriages, every medical form, gravidipara numbers, pregnancies versus living children, the math of my grief. Check here if you've had miscarriage, stillbirth, termination, tick, tick, tick. Every ultrasound, any previous losses, before I can see if this baby is alive. Waiting room full of happy pregnant women. I'm the one who lost babies. Will this be the appointment where I hear incompatible with life again? Even years after my last pregnancy, the blood bank, pregnant in the last 12 months, reminder every time I donate. New doctor, any pregnancies, any previous pregnancies? It's in my file forever. And in this country, I have to take that information with me to every new doctor because we don't have a centralized system. Insurance forms, medical history, routine appointments. I even have a permanent line on my insurance forms from my financial planner about my life insurance that specifically excludes pregnancy loss complications. The truth is, the medical system is built on documentation, on history, on tracking every pregnancy, every outcome, every loss. And that's necessary for good care. I understand that. But it means that lost parents can never just move on. We're required to carry our losses with us, recite them on command, and watch professionals process our pain over and over and over again. Every retelling is a re-traumatization. Some days I could handle it. Some days I couldn't. Some days I was strong. Some days I sobbed in the parking lot for 30 minutes before I could drive home. And the professionals asking, most had no idea they were the 15th person to ask me that week. No idea I'd been up since 4 a.m. terrified. No idea that their tone, their words, their faces were being seared into my memory forever. Let me give you specific examples from my medical journey of what hurt and what helped. Don't worry your pretty little head, said to me by one of the gynaes that I used. It was the first time that I was seeing that doctor. I was 7 weeks pregnant after 3 losses. We saw a heartbeat and relief. Then I got the speech. Don't lift anything. Don't eat this or that. Think positive thoughts. I was literally told, don't worry your pretty little head about things going wrong. Every piece of advice directed at my husband, not me. I wanted to strangle him across the desk. What was wrong with this appointment? It was patronizing, dismissive, patriarchal. It ignored my expertise. I've researched this extensively. This was the 6th pregnancy on my journey. I'd done this before. He treated me like I was cute and emotional, not intelligent and informed. Didn't see me as the primary patient. What would have helped? You've been through a lot. What questions do you have? Acknowledging my knowledge and my experience. Directing all of his conversations to me and not my husband. Respect that I am terrified for valid reasons. The maternal fetal medicine specialist, a super expensive one. And my 12-week scan showed cystic hygroma. I needed a CVS test, really big needle stuck into my belly. I was crying. Obviously, we just received devastating news. The doctor turned to me and said, if you're going to be emotional, we can't do the test. Pull yourself together or come back another day. He shamed me for having emotions about my dying baby, made my emotional state the problem, not the devastating diagnosis, implied I was being difficult. I was being human. Said that while I was naked from the waist down, vulnerable and terrified. My response, after my husband gave me the look that said, don't kill him, me being emotional has nothing to do with my ability to keep still. And I did. I kept perfectly still because I'm not incompetent. I'm grieving. What would have helped? This is devastating news. Completely understandable that you're emotional. Take a moment if you need. Acknowledge the trauma that I've been through, not shame it. Showing a tiny bit of compassion, it seriously costs nothing. With that same pregnancy, I was 14 weeks pregnant when my termination was scheduled for the next morning. I was given medication to soften my cervix, and I delivered my baby on the toilet alone in the dark at 2 a.m. I rang the call bell in absolute panic. The nurses were brusque, matter of fact. You should have expected this, were the words that came out of their mouths. My baby was taken away in a kidney dish. No acknowledgement, no compassion. I was left alone, crying in the dark. The things that went wrong, no one told me delivery was possible. I was there expecting a DNC the next day. To them, they treated it like a routine medical event. It was my baby. The baby was taken away like medical waste. It felt inhumane. The night nurses had no training in bereavement support at all. I was left alone immediately after. No checking on me, no compassion. What would have helped? Warning that delivery was possible. This medication may cause you to deliver before surgery. When I rang the bell, I'm so sorry, this must be terrifying, let me help you. Baby wrapped in a blanket, not a kidney dish. Show some dignity. Offered to hold the baby properly, not taken away immediately. Stayed with me for just a few minutes, not leave me alone in a crisis. Check on me throughout the night. Trauma response is real. I changed the hospital policy after that night. After I'd recovered enough to fight, I took my complaints to my gynae. He called the matron while I sat in his office and changed the protocol immediately. But that was too late for me. And how many women before me went through the same thing? I asked to see my baby the next morning after the shock and terror of the middle of the night. The nurse brought my baby to me in the red medical waste bucket, naked, alone, thrown in the bottom of a plastic bucket. I held my baby one last time. Still can't believe that any human could bring someone their baby after I asked to see my baby in the medical waste bucket. They were treating my baby as rubbish. No blanket, no dignity. The nurse handed it to me like it was nothing. Things that would have helped in that situation. Having my baby wrapped in a soft blanket, small basket, private time, not rushed. Memory making offered, footprints, photos, locks of hair. I didn't even know to ask at the time. I now know that all of those things are possible and that there are amazing nurses throughout the world that offer this. But for me, it wasn't even offered. The final example is about choice of language, particularly in the medical field. The phrase incompatible with life is so cold and used so often. I heard this phrase from the radiographer, from my gynae, from the maternal fetal medicine specialist, multiple times in the space of 72 hours. Every single time, it was a cold stab to my chest. I understand that it is medically accurate, but it is emotionally devastating. It is so clinical. My baby, incompatible with life. No softening, no compassion in the delivery. No one thought to say it differently when they repeated it, because that was the biggest thing. Absolutely, yes, I understand it needs to be said. But if you're going to say it multiple times, say it with a little bit of compassion. Some things that would have helped were saying things like, I'm so sorry, the baby won't survive after birth. It's the same information, but it's human language. Say it once, absolutely, compassionately, but then don't repeat unless asked. Acknowledge the fact that those words are really difficult to hear. Other words, when I use baby and the doctor insists on calling it a fetus, mirror the words that the lost parent is using, because those are the words that they're wanting you to use. Here's what healthcare providers don't realize. It's not just one appointment. It's not just one insensitive comment. It's the cumulative effect of multiple retellings, dozens of appointments, multiple losses, years of this. With 6 losses and an average of 5 to 10 medical professionals each time, that's 30 to 60 retellings just for the losses. Add my successful pregnancies and ongoing care, blood donations, new doctors when I moved. It's retelling my trauma over and over and over and over again in 12 years. Each retelling relives the pain. It risks re-traumatization. It depends on the professional's response. Are they compassionate or dismissive? It adds to or heals the wound, depending on that reaction. Good experiences with compassionate providers heal. They give me hope. They make me feel seen. Bad experiences with dismissive providers wound. They confirm my worst fears, that I don't matter, my babies don't matter, my grief is inconvenient. Healthcare providers, you get to choose which kind you are, healing or wounding. It's a choice you make in every interaction. Choose wisely. So what does trauma-informed care look like? What do you say? What does help? Here's what I learned from the good providers. Dr. P did so many things right for me. My OB-GYN was my last of my 3 miscarriages in a row, and my pregnancy with Carl and the miscarriage after that. The things he did right, he listened to my full story without interrupting, acknowledged that I'd been through a lot, never dismissed my anxiety. Of course you're worried, you have every reason to be. Gave me agency. What would help you feel safer? Do you need extra scans? Do you need more frequent appointments? Celebrated my milestones. You made it to 12 weeks. That's huge given your history. His words that changed everything for me. It was everything in moderation, including moderation, which was permission to live during the pregnancy, not restrictive instructions. Marianne was my midwife who healed what doctors broke. The things that she did right, a long first appointment, 90 minutes. She actually really got to know me. She asked about my fears, my previous experiences, and my needs. She never rushed me, even when I cried for 20 minutes. She involved my toddler. She acknowledged that I had a life outside of this pregnancy. She had Carl rubbing progesterone cream on my belly, which made him part of the whole process. She checked on me emotionally, not just physically. How are you today? Not how's baby? She made me feel held and not managed. The radiographer who got it, what she did right. Before the scan, I know this is scary given your history. I'll explain everything I'm seeing as I go. During the scan, she narrated every measurement, every image, included me in the process. When she found the heartbeat, she gave me time to cry. She didn't rush to the next measurement. She printed extra photos. She knew I needed them after so many losses with no photos. And afterwards, as I was leaving, she said, "Congratulations, everything looks exactly as we'd hoped. You can breathe." Here are the things that all of the good providers had in common: acknowledged my history, they didn't brush past it, validated my fears, it wasn't dismissed as just anxiety, gave me agency, they asked what I needed, took their time, they didn't rush, they were never showing any irritation. They saw me as a whole person with a life, not just a uterus or a pregnancy. They used human language, not just medical jargon. and they made me feel seen and not processed. The impact of compassionate versus dismissive care shows up even in how people review my book. The Goodreads reviewer wrote this about the medical professional angle. Something unique in this author's approach to the medical professionals whom she consulted is that more training is needed to ensure that women experiencing pregnancy and infant loss are cared for with greater sympathy. The author experienced the male patriarchal system to be rather cold and clinical. The contrast is shown beautifully when the author shares her birth experience with the midwife and doula. Never does she lose sight of the importance of the medical professionals, but she addresses the lack of empathy she experienced. And here's the line that matters most. I believe obstetricians and gynecologists would benefit by reading her story. A reader, someone who's never worked in healthcare, who read my story as a mother who experienced her own loss more than 30 years ago, could see that medical professionals need this training. If a lay reader can see it, why can't the medical system? If you're a healthcare provider watching this, here's what you can do differently starting tomorrow. Acknowledge the retelling is hard. It is literally 30 seconds of compassion. Try. I need to ask about your pregnancy history. I know this can be hard to talk about. Take your time. Why this helps, it acknowledges the emotional labor and it gives permission to the person to feel. Ask if they want to tell the full story. Instead of diving straight into questions, try, I can see you've had multiple losses in your file. Would you like to tell me about them, or would you prefer I just read the notes? Some days we can't talk. Some days we need to. Let us choose. Don't make assumptions about grief timelines. Everyone is different. Instead of this was 5 years ago, you should be over it by now. Try, how are you feeling about your previous losses now? It's an open question and there's no judgment. Grief has no timeline. 5 years or 5 weeks, 30 years or 30 minutes. It doesn't matter. Watch your language. Words matter. 30 seconds can change everything. Never say, at least you can get pregnant. At least it was early. You can try again. Everything happens for a reason. God has a plan. Be grateful for the children you have. Instead, say, I'm so sorry for your loss. This must be devastating. Your grief is valid. I'm here to support you. What do you need right now? Sometimes just sit in silence. Be present. Don't try to fix it. Offer choices, not directives. We've lost control. Give some of it back to us. Instead of you need to wait 3 cycles before trying again, which is a directive, try. Medically, I recommend waiting 1 to 3 cycles. How does that feel for you? What are your thoughts? It makes it collaborative. Losing a pregnancy, so tied to losing control. Giving some choices returns some of that agency to the lost parent. This was a big one for me. Prepare us for the procedures. Information reduces trauma. You may have run this procedure multiple times. As a lost parent, I may have been through this procedure before, but not with you. Make it clear. My toilet delivery trauma could have been prevented with the medication I'm giving you to soften your cervix may cause cramping, bleeding, and in some cases, delivery before your scheduled procedure tomorrow. If that happens, press the call bell immediately. We're here to support you. It's not even 30 seconds, and it would have changed everything. Remember to explain everything, particularly to someone who is in a traumatic state. Yes, they may have experienced it before. Yes, they may have researched the information. But when you're in the trauma state and you're checking into hospital and you know that you're about to make a life-changing decision, be clear. Be as clear as possible. Treat our babies with dignity, always. Never refer to the baby as products of conception or fetal tissue in front of us. Yes, they are medical terms, but they are terribly, terribly traumatizing. Never take the baby away as medical waste. Treat it with dignity. Never rush us through seeing or holding if we ask. Never act like our baby is routine medical waste. Instead, mirror the words that we use to refer to our baby. Use baby if we use it. Follow our lead. Wrap the baby in a soft cloth. Show a little bit of dignity. Offer memory-making opportunities, photos, footprints, handprints, lock of hair, time alone. Ask, would you like to see or hold your baby? Don't assume it's a no. Finally, check your face. We're watching you. When you hear my history, 6 losses, what does your face do? We notice eye rolls. You think I'm dramatic. Pitying looks, you feel sorry for me. Glancing at the clock, my trauma is inconvenient. Discomfort, you don't know what to say. Blank professional mask, you actually just don't care. We also notice softening. You're human. Tears in your eyes. You're affected by my pain. That means something, only when it's genuine. Leaning forward, you're engaged and present. Nodding, you're listening, really listening. You can't hide your response. We're trauma-informed. We read people. So choose. Do you want to be the provider I remember with gratitude, like Dr. P, Marianne, or Julia? Or the one I use as a cautionary tale in my book, the Polish OB-GYN, the expensive maternal fetal medicine specialist, the night nurses? If you're a healthcare provider watching this, here's what I'm asking. Get training in bereavement support. One afternoon course can change how you show up. Learn trauma-informed language. Understand grief doesn't have timelines. Know what resources to offer, support groups, therapists, baby loss organizations, empowerment coaches. Update your intake forms. Add, I understand this history may be difficult to discuss. Take your time. Offer, would you prefer to write this down rather than speak it aloud? Make the retelling as gentle as possible. Create protocols for loss. What happens when a miscarriage occurs in your office or at the hospital? Who's trained in bereavement support? What memory making is offered? How are babies treated with dignity? Have a plan so staff aren't making it up in the moment. And something here that happened to me is if something goes wrong in the ultrasound, that mom probably still wants a photo of their baby. Examine your own biases. Do you believe early losses don't count? Do you think women who terminate brought it on themselves? Do you get impatient with emotional patients? Your biases show, we feel them. Do the work to unpack them. Advocate for systemic change. Hospital policies, no more medical waste buckets for babies. Training requirements, bereavement support should be mandatory. Funding for support services, therapy, support groups, resources. Use your voice to change the system, not just your own practice. And if you want to do better but don't know where to start, invite me to train your team. I speak at hospitals, medical conferences, nursing schools. I'll tell my story, the good, the bad, and the traumatic, and I'll give you practical tools to support lost parents better. Because here's the thing, you have immense power in these moments. 15 seconds of compassion can change a lost parent's entire healing journey. 30 seconds of dismissiveness can add trauma that lasts years. Choose compassion every time. To the lost parent watching, if you're watching this and nodding along, you're not alone. The medical system is re-traumatizing. You're not too sensitive. You're not overreacting. Your grief is valid, and you deserve compassionate care. Comment below which phrase hurt you most. Which provider made it better? Let's create a resource for each other and for medical professionals willing to learn. To healthcare providers, if this video made you uncomfortable, good. That discomfort is the beginning of change. Learn with it, do better. And if this video resonated, if you're already doing this work, already showing up with compassion, thank you. You're making a difference. Keep going. I've told my story to more than 50 medical professionals. Some listened, some dismissed, some healed, some harmed. Which kind will you be? There's a link in my description to my book, All of These Lines, the full story of my 6 losses and what I learned. If you're a healthcare provider interested in training for your team, email me at info@biancajohnson.me. And if you're a lost parent needing support, you're not alone. Resources are in the description.